So that's a disaster. We know that that's a disastrous vaccine, but we started looking last week at Moderna. How's Moderna doing?
Well, Moderna, perhaps the biggest story with Moderna vaccine is we have the world's first vaccine injury that has been reported. and
Do tell. Someone actually got injured by a vaccine? It's not a lie? Tell me all about it.
This is Ian Hayden. He was one of the participants in the Moderna trial. He took to Twitter and went public about his vaccine reaction. Now, he was one of the people that had the grade 3 systemic reaction that we reported last week.
Right.
And said, quote, "Deep breath. So I had a bit of an issue after getting my second injection of a candidate COVID vaccine." But if we go to the stat interview from Moderna, he really starts to extrapolate this experience and give you
so there's a little bit more than feeling a little crummy then.
Yeah. So he says, quote, 12 hours after receiving his second dose, he developed a fever of more than 103 degrees, sought medical attention, and after being released from an urgent care facility, fainted in his home. Now, about the fainting, he said he got up to go to the bathroom and became so nauseous he threw up. On his way back from the bathroom, he fainted. His girlfriend caught him and kept his head from hitting the floor. Although he continued to say he received great medical care, and though he felt more sick than he ever has before.
That's pretty drastic, right? To faint, have your, was it his wife or his girlfriend catch his head? I mean, that's incredible. One of the biggest problems they've had is something called syncope, right? Which they're passing out. They're falling downstairs. They're having car accidents after having had the vaccine. And, some of them, it happens immediately inside of the office right when they're getting the vaccination. Others go on to have this issue. And now imagine, what if there is a deadly issue for 1 in, say, 50 people? What if this vaccine is deadly for 1 in 50 people? Or what if it causes a severe autoimmune disease that takes away 30 years of your life, but we'll only see it 3 years from now? You see, there's only even 45 people in this study. So what if a 1 in 50 problem is out there? Because what we just discovered was a 3 out of 15 problem. What if there's a way right now inside of his body, he has a fake RNA message that his body thinks has been sent by his DNA that is actually making his cells mutate artificially, right? Crank out proteins and things to try and protect him. That process, we don't even know if it ever stops. It could keep going and going and proliferating. Who knows where he's at? And by the way, he hasn't come in contact with coronavirus as we know it. What happens when that happens? What happens if he has antibody immune enhancement? Are we going to know if he gets severely ill? If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.